Hello, everyone, and welcome to helpNYC and the Community Speaks Community Partnership event. I'm so excited that everyone is in attendance today, and this is part of helpNYC's organizational support. Before we start, I'm just going to go through. Some of you are new to helpNYC. I want to welcome our listening partners who are here with us today. Our community partners, thank you for being here, and everyone else, of course. To tell you a little bit about helpNYC, some of you may know this already. We are a peer-driven nonprofit here in the city of New York, and our primary work is to advocate for lower barriers to entry-level services, and lift the lives of underserved New Yorkers by using our lived experience. And everyone who works, that actually volunteers at helpNYC, because we're a volunteer initiative organization now, we all have lived experience. For instance, I'm in recovery from substance use. I was formerly street homeless and shelter homeless. As well, I live with mental health challenges. And I just celebrated 10 years in supported housing this past week, and I'm getting ready to move on soon. So we use that experience to do our work here at helpNYC. Some of you may know about our signature program, which is the helpNYC.info resource navigator. This is a place that people who are in need can come and find verified low barrier services across all 5 boroughs in the city of New York. And we list programs that are low barrier entry level, but we also build a partnership with these programs that we list, and they go through a vigorous onboarding process. So we make sure that the people in need get the information they need to receive services before they even walk through your door or contact you. As of yesterday, we have 138 listening partners, and we love each and every one of them. If you're in the room, thank you for listening with us. And so far, we have onboarded 199 programs in New York City. And some of you may have gotten emails from me, but we are in the midst of our free holidays, meals, and more campaign, where we list programs across the city that provide food distributions, a bunch of other things for New Yorkers that need help during the holidays, toy drives, free events, and our Thanksgiving campaign, which is within this program, is the numbers aren't completely in yet, so it may be more, but we served at least 2,400. We connected at least 2,400 people to programs such as food distributions, turkey giveaways, health and wellness fairs that were centered around Thanksgiving holiday. And this number is so big because we had programs list with us. The free holiday meals and more, we are currently listing all of the winter holidays, and we encourage you to come and list with us if you are having a toy giveaway, a winter coat giveaway, a secular holiday, or a Kwanzaa, or Christmas, or Hanukkah, or any other holiday event here in the city during the holiday season. And the reason we're here today, and I mentioned a little bit earlier, is that we have an organizational support program here at helpNYC. A lot of our listening partners take advantage of that because we are a neutral third party. We don't control any funding or policy change, but we have a vast network of organizations and people that we work with, and we can, if we usually don't have the answer, we can find the person who does for you. And some of the things that we have done over the last year was we created the Food Assistance Collective of New York, where food assistance providers in the city can talk at the ground level, peer-to-peer, instead of having it connected to funding or the city or to a policymaker. And that's been really, really great for the members of FACNY to have that dialogue kind of off the record. We've also co-sponsored and helped organize several mayoral town halls. You may have been bombarded with our flyers during that time. We also were an organizing partner for the Upper West Side Open Hearts Initiative. If you're not familiar with that, they were the lead coalition and now organization that helped the men of the Lucerne stay in their hotel as long as they could. It was all over the news. We provided technical and organizational support for their organization. And we've done a couple of food justice panels, and we just recently did a homelessness in New York forum with the Midtown South Community Council. One other thing that we do is when organizations reach out to us with questions, we tend to get a lot of the same questions. They trend with us. So the Meatloaf Kitchen at University Community Services down on the Lower East Side reached out to us with United Way and Coalition for the Homeless and a couple other organizations asking us, how do New Yorkers that are experiencing homelessness get help with getting their EIP? That is a multifaceted process, and they have to establish a bank account and mailing address and get all the paperwork for the IRS. And we combined all of our listening partners into one document where a volunteer or a social worker, case manager, a peer specialist could look at this document and say, okay, we need to go here to get you a mailing address. We need to go here to get you a bank account. And this is all the documentation that you need. So the process was very transparent. And from what I gather, Meatloaf Kitchen was able to help a lot of people along with some other of their partners. So we're really grateful to be a part of that. If you would like to join us as a listing partner, if your programs aren't listed on helpNYC.info right now, or if you would like to talk about a partnership, please reach out to us. Also, follow us on social media. That QR code will take you straight to our social media links. So while you're here in the event today, just follow us on social media. We love the attention. Who doesn't love the attention on social media? So without further ado, I would like to welcome Sarit and Maddie to introduce from the Community Speaks project at Columbia University. So come on down.
Thank you, Rue. Thank you for the introduction, and thank you and helpNYC for having this event with us today. My name's Saret. I'm the Partnerships Coordinator at Community Speak, and I'm very excited to speak with you all today about our project, our survey, and how we can help give a voice to all New Yorkers in our pandemic recovery and future crises. So Community Speak is a project born out of the need for targeted assistance at the beginning of the COVID-19 pandemic. It began as a primarily health-related survey in partnership with the medical school. But as data on the spread of the disease became more widespread while information on the secondary impacts did not, the project adopted a new focus. We knew New York City residents were hurting due to lockdown, school closings, and high unemployment, and yet government and local organizations did not have the important micro-level data that was critical to understanding who was hurting and how. So along with the School of International and Public Affairs, Community Speak emerged as a project to help collect this data about New York City residents to help empower city officials plan for recovery, enable local leaders to define needs and identify vulnerable communities, and understand and assess the best method for deploying resources. The project will continue to gather data throughout the pandemic and beyond, and to build a framework for baseline data collection that can be used routinely and for future crises. So 5 prominent faculty across the programs and disciplines at Columbia University have teamed up together to make this project possible. They came together in an effort to bridge the gap between documented community needs and policy decision-making. So our principal investigators consist of Esther Fuchs, who besides directing the Urban and Social Policy Program at Columbia's School of International and Public Affairs, she has served as special advisor under Mayor Bloomberg and worked frequently with Mayor Dinkins since 1995. She also is on the board of she's also on the board of many organizations around the city, such as the Fund for New York City, for the City of New York. We also have Sarah Holloway, who has been in the public and nonprofit sector for 25 years and has co-founded 6 ventures in K-12 education around the city. She also remains on the board of several nonprofits throughout New York. Michael Nutter, he's the former mayor of Philadelphia, who served from 2008 to 2016. He's a current professor at Columbia and provides invaluable perspective as an experienced leader in city government. He's worked closely with Mayor Bloomberg and continues to work with mayors across the country as part of Bloomberg Philanthropies What Works Cities program. And then lastly, we have Robert Shapiro and Noemi El-Haddad. Robert Shapiro is a distinguished professor in political science at Columbia University. He served as a director for Columbia's Institute for Social and Economic Research, and he specializes in statistics and survey research. And Noemi El-Haddad is the program director at the Department of Biomedical Informatics at the medical campus, and she specializes in computer and data science. So this group of principal investigators on the project helps us maintain an academic integrity throughout the project through their experience, knowledge in survey research, data science, and urban policy. And they also help us connect with organizations and city leaders across New York City to ensure that the project is working for the benefit of all New Yorkers. So these are the 4 pillars of our project: micro-level data collection, our strategic partnerships, policy recommendations, and data sharing. The core focus of the project is collecting microdata through regular surveys of New York City residents and ensuring we reach all parts of the city. So in order to reach New York City respondents and make sure the survey is accessible and relevant to all, we work with our community partners, such as government officials and local nonprofits, building this strategic partner network. We then use our strategic partner network and the microdata collected when we analyze the findings from our most recent surveys and formulate policy recommendations. And we also want to make sure that the analysis and recommendations proposed are understood in the context of what is going on in the community with the help of these partners. Lastly, our project isn't useful functioning in isolation, so we want to make sure our data is publicly available and ensure that city government, local leaders, and community organizations like yourselves can get the information they need to effectively target their resources. So I'm going to pass this on to my colleague Maddie, the project coordinator here at Community Speaks, who will tell you all a little bit about our previous survey. We previously completed a successful survey this past summer where we recorded over 750 valid responses.
Hi, everyone. Thank you, Surette, for that overview. So one of the main kind of aspects of our project is that we are collecting micro-level data. For those of you who don't know, microdata is a statistical term for individual response data, and it can be used to identify trends and inequalities across communities and demographic groups. Our individual survey collects information concerning the secondary effects of COVID-19 on various aspects of individuals' lives. Some of the categories that we include in our survey are questions on employment, financial security, access to resources, education, health, and security. And we have a little snapshot of sample questions here that we specifically chose because they're relevant to the data that we've included in this particular presentation. And all of our questions that are designed strategically. So some of them are worded because that's the way they're standardly worded on different types of surveys. And we want to make sure that data is standardized. For example, any questions around mental health have been vetted by Noemi El-Haddad, who's on one of our PIs, who specializes in health-related surveys. But we also consult with our partners on the accessibility of our questions, as well as whether or not it's measuring what is going to be beneficial for them. So some of our data findings, our most recent iteration of the survey ended at the end of August in 2021. We received over 750 valid responses. I think actually over 1,000 responses, but we weren't able to include all of them. For some of the things that we found that we thought were worth highlighting, and this to you all, was that 52% of households with children in our responses lacked access to childcare. One particular demographic that we found in our data that was particularly impacted by the pandemic were Hispanic Latinx population in New York City. And this isn't something that many people are talking about. And so it's something that we definitely feel we're definitely happy that we were able to capture because it's important. 73% of Hispanic female respondents felt that they were unable to control important things in their life. And that's something that we have as kind of one of our indicators of mental health. Hispanic females also overwhelmingly lack access to basic resources, such as difficulty finding cleaning equipment and PPE, difficulty accessing transportation, and difficulty paying rent and housing. One thing that was particularly shocking is that our data showed, similar to NYC labor stats, that what everybody knows is that unemployment obviously increased during the pandemic. These top stats are from September of 2019, right before, a few months before everything shut down. And the bottom stats are from 2 years later, September 2021, after reopening. And still, the numbers are shocking. And while our overall stats are similar to NYC labor stats, our Hispanic Latinx respondents reported 12.9% reported that even after reopening, they are still unemployed, which is that change is drastically higher for that demographic than any other demographic. Other things that our survey has found have been similar to what we've seen in the news and what we know from our peers, that Asian demographics experienced or feared discrimination related to the COVID-19 pandemic at much greater volumes than any other demographic, but we did collect that information on all demographics. So looking at kind of where kind of our data on the last survey is lacking and where we're looking to increase, the Bronx was one of our lowest response rates. And so if you look at this graph, it shows in the dark blue are the census numbers at percentage numbers, and then the light blue is our data. And so we were obviously highly overrepresented in Manhattan and severely underrepresented in the Bronx. That being said, the Bronx did seem to experience more severely some of the things that we recorded in our data, but we would like to get a better response rate from the boroughs, the outer boroughs outside of Manhattan on our next iteration. And then survey demographic reach, we were overrepresented by white populations and slightly overrepresented by Asian populations, but we were severely underrepresented by our Hispanic Latinx populations and also need more responses from Black or African American populations in New York City. And I'll hand it back off to Saret, who will talk a little bit more about how our strategic partners can help us find those numbers.
Thank you, Maddie. So as she mentioned, our partners are critical in helping us reach all aspects of and all parts of the New York City community. So we work with our partners in both a digital and an in-person capacity. For digital survey dissemination, we work to make it as easy as possible for partners to share the survey to social media and email newsletters with prepared text and graphics for your distribution. But we also love to collaborate in person to the extent that partners have any in-person activities or operations. For example, 2 weeks ago, we attended a college and career fair with New York Urban League, where we were able to speak with parents and young adults about our survey and why it's important to share it with their communities. So we can tailor these sort of partnerships to each partner's specific capacity. Just to let you all know how we've been expanding thus far, there's a list of some of our the partners we've reached, including ABNY, New York Urban League, helpNYC, OATS, Good Shepherd Services, and the like. And as Maddie mentioned, this project really cannot be sustained without these sufficient survey responses. So we're aiming for 1,500 responses with our current version of the individual survey, and we plan to grow this number each round. And not only do we need a large enough sample size, but we also need a sample proportionate to the New York City population. This means we need to account for each demographic and subpopulation in New York. Specifically, as Maddie mentioned, we're trying to reach more Black New Yorkers, Hispanic and Latinx New Yorkers, and New Yorkers in households with children. To ensure that we meet these goals, we're partnering with these community-based organizations around the city to help us disseminate the survey to their members and use the most impactful tactics. But similarly, this project is not functional in isolation. The findings from our survey, our analyses, and our policy recommendations will be shared with local leaders, city officials, partner organizations, and the New York City community to allow the data to guide recovery efforts and general data-driven policymaking in the future. Our partners once again play a vital role in spreading the word about our findings and bringing key figures to the table in policy discussions. And just to reemphasize, our partnerships are very much a two-way street, and we want this to be a mutually beneficial relationship. So we want to be able to provide organizations like yourselves information that is useful for your networks and relationships. For example, we found in our last survey that 33% of respondents stated that they would utilize community organizations such as neighborhood nonprofits if they were in need of food and water. Similarly, 19 and 18% of respondents said that they would utilize neighborhood nonprofits for elder care and adult care should they need to seek it out. But we do always welcome what feedback on the data that is most useful to you. So currently our project is engaging our partner network to help disseminate the survey to all New York City residents and capture as many responses as possible. Our current survey opened November 15th, and we will close mid-January, after which our team will analyze the survey data and find the key findings. Then we will work closely with our key partners to discuss these findings and develop policy recommendations, which will then be shared and distributed to partners, press, government agencies, and officials. As we look to the new round of the survey, we'll rework any questions needed that are relevant to the timeframe with collaboration from our partners before we release. So thank you all so much for your time today and letting us share this information with you about our project, our survey, and our search for partnerships. If you are interested in partnering with us or learning more about the project or what a potential partnership would look like, please contact me at the email that you see on the screen, or feel free to visit our website. You can also reach out to Rue for our contact information. Thank you again, Rue and helpNYC, for hosting this event for us today. We're very happy to answer any questions you all may have about the project, the survey, or our partnerships.
And thank you, Surette, and I'm sorry for mispronouncing your name. And thank you, Maddie, and the entire Community Speaks project team who is here today. As Surette mentioned, please reach out to her for any information about the Community Speaks project, and reach out to me for anything about helpNYC. We would love to hear from you.